Today we have an 18-year-old boy who was referred by a podiatry colleague. In the past, he's had 3 partial nail avulsions and unfortunately they've been unsuccessful. So today we will be performing a wedge resection. From the pictures, if you have a look at it, the nail is actually quite straight. However, the proximal section, there is still some regrowth occurring, but most importantly, the inflamed tissue is starting to fold back over the nail. With the wedge resection, we'll be able to get rid of this. Instrumentation-wise, we will need a 15 blade, the handle, a 3mm diameter curette, some pickups, a suture holder, and today I'll be using 3/0 nylon. Okay, hello again. Now we're going to demonstrate the hallux block. We're using 2% xylocaine plane for this, and usually use about 5mm, especially in a hallux of this size. The reference point will be the extensor tendon. We're going to go laterally first because it's a lot fleshier there and it's a lot easier to perform the injection. And 1, 2, 3. We'll put some bolus amount of local anaesthetic on the dorsal aspect and then advance it plantally until we see blanching at the plantar aspect, and they should get those plantar digital nerves. And that's one side done. And then we're going to go medially, just next to the extensor tendon. We can see that the nail is straight on that distal aspect, but then there has been regrowth from the mid portion pretty much all the way proximally. There's also been a little bit of phenol damage. You can see some discoloration and lysis of the nail. So we don't really need to remove too much of this section. We just need to remove that tissue right there. So here we go. So with the wedge resection, we cut straight down going through the nail plate. And then taking an elliptical-like incision of that tissue that was quite inflamed. And this is done all with the 15 blade. We'll grab some pickups. We can then remove this ellipse of nail. Okay, we're going to throw a proximal suture to begin with. And these are just going to be a series of simple sutures. Just a dab of chlorhexidine, or you could use betadine. We're going to use just to begin with, an island dressing. Just to give it a little bit of